Hey guys, welcome to today's episode. I have a very special guest. He's actually the first guest that is outside of the United States that I can think of. Mick Hughes. He is a physio in Melbourne, Australia, who also specializes in ACL rehab. I've had the privilege of connecting with Mick through Instagram, and I've definitely enjoyed learning from a lot of the content that he posts. I would say that he's equal in line with me with just the amount of passion that we have for this one specific injury and just the amount of content that we've been able to kind of put out there. He's even developed his own criterion-based protocol, which I actually am a huge fan of, and I'm going to let him share a little bit about that later on the show. Welcome to the show, Mick.
Hey, Wes, thanks for asking me to be part of the show. And yeah, thank you. I'm a huge fan of the stuff you're putting out, and it's nice to connect. So yeah, thanks for asking me to on your podcast.
Appreciate it. And Mick, let's just kind of dive right into things like I like doing. Do you mind just telling us a little bit about your background?
Yeah, so I'm a sports physiotherapist here in Australia, which I think to your American listeners and followers, I'm a physical therapist. So we call ourselves physiotherapists. Um, in Australia, we have I guess a pathway. So once you finish physical therapy school, you can you can start a pathway where you can specialize and call yourself, much like our doctors can be a sports doctor, an orthopedic surgeon, a cardiologist. Here in Australia, we have a title pathway where you can become a sports physical therapist or a sports physiotherapist. You can be a musculoskeletal therapist. You can be a women's health physiotherapist. You can be a pediatric physiotherapist, and you can actually call yourself that. If you do the following pathway, you have to do some postgrad education to be able to call yourself a sports physiotherapist. But I've just completed my Masters of Sports Physical Therapy or Sports Physiotherapy. So yeah, so that's my, I guess, my title and my area of expertise. And I guess to narrow that down a little bit further, I've got a very strong interest in ACLs, and I manage when we are working normally, which is not right now in the pandemic, but before the pandemic, I was seeing about 30 to 40 ACL reconstructions or non-operative ACLs per week in the clinic, which was quite nice. So it allows me to specialise and get a good understanding of what works and what helps people improve. So I think it's probably a bit of a snapshot about my clinical caseload. On top of that, yeah, I've got a strong interest in sharing information about ACL. So very strong social media presence with the YouTube channel and Instagram um, profile and Facebook and Twitter and all that kind of stuff, but also have developed a set of guidelines, as you mentioned, with my good friend Randall Cooper. And we've also got an online educational platform called Physio. So keeps me busy, keeps me busy outside of the clinical side of things. So I just like to share a lot of information that unfortunately often gets blocked behind paywalls online. So I had the privilege for a number of years, by studying my masters, I was able to get access to a lot of really good, valuable papers and share that to a wider audience to help lift our game in the rehabilitation stakes.
Gotcha. Cool. Yeah, it sounds like you are obviously a very busy man with not only treating, but also, being on top of the research and developing your own protocol and all that kind of stuff. And we'll dive into a lot of that stuff. And a personal question that I want to ask you is, what made you decide to specialize in ACL rehab?
Yeah, it's a good question. I guess it came from probably thinking that I sucked at it to start with. Because, like I reflect on some of my early cases as a new graduate, and I probably would have, in my first 2 or 3 years, I would have had a good caseload of ACL injuries, maybe like 2 or 3 a week. And I think if looking back now, I really did a poor job. If I'm being critical upon myself and appraising my rehab techniques or the education I was giving to those patients, and it really sort of made me want to become better. And back in 2016, I actually got a position with a professional sporting club here in Australia, and it's a sport that's probably a bit unfamiliar to your listeners, and it's a sport called netball. It's like basketball, but there's no backboard. and it's largely played by females. But there's also no dribbling up the court, so you can only you'll make the ball up the court, get the ball up the court by passing. So there's a lot of jumping, landing, pivoting, twisting, and turning. And because it's a largely female dominant sport, there's lots of knee injuries. And so I was entrusted with these 10 professional athletes to look after them. And my main goal was to not allow an ACL injury to occur. That was my own personal goal I wanted to achieve. And on our contracted list, we had a player who was rehabilitating a previously reconstructed leg when she turned up for pre-season training. So one, I didn't want that to happen under my watch. And two, I didn't want to have another one of our athletes sustain an ACL injury under my watch either. So I went about researching and really diving into the ACL literature to become a better clinician. And that then sort of flowed on from that. So that's where I guess my interest in ACL literature and ACL research really came to the forefront back in 2016, and it's evolved from that.
Gotcha. And I think a lot of people recognize you as a pretty big ACL rehab contributor, especially in the social media world on Instagram. And I've reposted a ton of your content, just especially because you do post so much, especially on the research side of things. And I know another big thing that you are also really known for, as far as you developed or helped co-developed a protocol. And I get a lot of messages by students asking me what protocols I follow and things like that. And I'm 5 years into my career, so relatively new, but at the same time I see a lot of ACLs to a pretty high volume. So I personally don't really look at least the protocols we have here anymore. They're all generally about the same, 0 to 2 weeks, you're kind of weaning off crutches if you're just ACL, whatever it is. And in 2 to 6 weeks, this, and then, some protocols nowadays are still saying that 6 months you're returning to sport, which I know you are in agreement that that's too early. And we'll talk about that later on. And can you just tell us a little bit about why you decided to make your own protocol? And for everyone out there, Mick's protocol is criterion based, meaning that it is very self-driven, meaning that you go at your own pace because you need to meet these criteria. That's why it's called criterion based, before you can go into the next phase of recovery. So much research is into that protocol. I've encouraged a lot of young clinicians who want to work with ACLs to look at Mick's protocol, because it's just, honestly, it's easy to digest, it's easy to manage. And to be honest, in my opinion, as far as like patients goes, they will like it more because there's no weeks or months, whatever it is, telling me that I should be doing this. Because in my opinion, the biggest issue with time-based protocols is, one, how can you tell? Because as you're aware, every ACL recovers a little bit differently. It could be the same age, same sport, same size, all that kind of stuff. Night and day difference. One person could be jogging at 12 weeks and one person not until maybe 20 weeks. It happens. But your protocol basically allows every athlete or person to just progress at their own rate, which is, in my opinion, how it should be.
Exactly.
Do you mind diving a little bit about that and why you decided to do it?
And they're really great points that you make, which is a big part of why the Melbourne ACL rehab guide was developed. Look, people do progress through rehab at their own rate, and I meet a lot of people who feel like they're not. I guess they feel like they're failing because they're not meeting exercise time points as given by their orthopedic surgeon. And so when they come and see me for a second opinion as to why things aren't going so well, they're really down on themselves because they feel like they're failing. And it's because they probably haven't taken into account, time is really irrelevant. It's, you get through your rehab at your own pace, and whatever exercise you do is done whenever you feel like it. And each exercise, there's so many different exercises that can achieve the same common goal of getting strong. So, that's where I don't like protocols, and that's why the Melbourne ACL rehab guide was developed. And I can't take all the glory for this. My good mate Randall Cooper actually did develop the first set of guidelines, the Melbourne ACL rehab guide, back in the early 2000s, when he was working with a lot of professional Australian Olympic skiers, and Australian football players here in Melbourne. He was seeing a lot of ACL injuries and was really frustrated with these protocols and these really time-driven protocols. And there wasn't a lot of research out there in the early 2000s about criteria. And so he said about criteria-driven rehab plans anyway, and he set about developing his own guidelines. And so we connected back in the about 2016 when I moved to Melbourne, and we basically sat down and developed an updated version of his original guidelines, and we turned his old guidelines into a new, more updated set of guidelines for the 2016 and onwards, and which has been great, and it's been well received, and I'm a huge fan of letting people go through their ACL rehab, and trying to encourage let them go through their rehab plan at their own pace and encourage them to meet criteria as they go along, because as you know from the guidelines, we've got a phase there where we're encouraging people to start running, jumping and landing. Now you really need to prove that you're ready to do those kind of things. And that's where phase 2 is about building the strength and the neuromuscular control. So you need to get better at those things before you start jumping, hopping, landing, and doing that kind of stuff. So each phase is setting you up for better success in the next phase ahead. And ultimately you get through to the point where it's all about maintenance as well, and trying to maintain your current high levels of physical functioning and return to play, not just getting through 12 months of rehab and then putting your rehab aside and sustaining then a second ACL injury because you've just forgotten about all those all important maintenance exercises moving forward. So the criterion-driven exercise plan is certainly an important part of ACL rehab. And for those that are interested, we've actually got the guide now, the Melbourne ACL Rehab Guide. It's free and it's online. You can't download it as such, but rather you work with your physical therapist or your physiotherapist to enter in the data and enter in your results so you can pass through the rehab. And the good thing is we're actually putting the Melbourne ACL Rehab Guide now to test. And a university here in Melbourne is conducting research on some of the outcomes that we're looking at with the guide. So you'll be also helping better people's outcomes in the future by taking part of the Melbourne ACL Rehab Guide online database that we've got now, which is freely accessible. So it's at Melbourne. So www.melbourneaclguide.com for those that are interested.
And I will certainly link that, in the show notes for any of you who are interested. And I'm definitely going to be checking it out. And I'm probably going to start inputting some of the data for my athletes as well. And, Mick, before we even hopped on, I already knew I was going to like you just based on our common interest in trying to battle this injury and everything like that. And, at the end of the day, I think between the two of us, what we would want most is to decrease these second tear rates. And yes, obviously we want to prevent the first ones, but the ones we get for rehab purposes, I always tell them, I never want to see you again. Let's do this one and done. Let's do it the right way. And a couple of the big things that I thought that I really liked that you hit was, for me, when I get messages and, when I post about an ACL rehab, pretty much every single ACL post, I will get an athlete or a patient, whatever it is, someone asking me, what week can I do this? And my answer, truthfully, is always, I don't know, because a lot of them are old videos and I don't remember exactly what week they were at when we did it, because it's individualized. And that's why I love your protocol so much. And what you pretty much just said was that every big milestone, let's say jogging and then cutting and then, aggressive plyometrics and then return to sport, that all needs to be earned. And that's the whole purpose behind a criterion-based protocol, is that you are making it, you earn it, you earn the right to do these things. And it's not just, oh, you are 16 weeks out, you can go do this. That's not how the body works. You need to earn the right to do these things. And I love that too. And I think another big point that you just talked about is, and in my opinion, not really talked about enough, is continued maintenance. You don't need to be lifting super, super heavy all the time after you're cleared. But at the end of the day, like you just said, you put in 12 months, hopefully around 12 months of work. Do you really want to let that go to waste because you're too lazy to get in the weight room and lift some more?
That's right. Yeah. I really encourage, basically with every person I meet will be, after this ACL rehab's done and you're back playing sport, and I'll get onto the performance side of things too. When people return back to sport, that's just one milestone. Returning back to performance takes that time, and ACL literature will tell us it can sometimes take 2 years for you to be back playing before you're back to your previous levels of performance. So, don't just get to 12 months and just think, yep, I'm good here. I'm just going to let sport look after itself. Push yourself harder and get back to that levels of performance. But the other thing that I really drive home is, people that have had an ACL injury need to really and especially an ACL reconstruction, need to really make a lifelong commitment to their knee, where they really take ownership of this knee injury, because we know that after an ACL injury and ACL, especially ACL reconstruction, the chances of this person developing some osteoarthritic change over 10 to 20 years is going to be a lot higher than those that haven't had an ACL injury or an ACL reconstruction. So once you're done with 12 months, it doesn't mean you just rest on your laurels and just allow, sport or life or work take over. We really need to be continuing some form of healthy exercise. It can be just general exercise. It could be going to the gym once or twice a week, but you need to look after your knee with a different mindset though. The mindset isn't all about you looking after your reconstruction anymore. It's about looking after yourself. So looking after your whole, you're looking after your body weight. We know that for extra, 1 kilo of weight that you put on, it's an extra 4 kilograms of pressure that your knee will start to feel over time. So, staying fit, staying active for the rest of your life needs to be basically a lifelong commitment, so you're not suffering from symptomatic osteoarthritis, 10, 20 years down the track and looking at a knee replacement in your 50s and 60s. Like these are the things that we often don't think about when we're 20 and 10 foot tall and bulletproof. But the reality is these are the things we need to look after many years down the track.
Yeah, I think always looking big picture is a thing that I really talk to my athletes about a lot. And at the end of the day, a lot of times, like, let's say you get cleared at a year and then your sport is right away. So you hop right into your season. Inevitably during a sports season, you're not lifting as heavy as you would be during the off season. And, you're going to play a lot of games, a lot of practices. So you're going to become a little bit weaker naturally because you're not lifting weights and you're putting more stress on your body. And that's when I tell athletes, like, you make it through the season healthy, great. That's exactly what I want. But that's when the maintenance needs to continue in order for you to continue to be strong. And, the athletes that I get to buy into that, and those are the ones who continue to have success. I would guess that between the two of us, our overall second tear rates are drastically lower than the national or whatever the global norm of, approximately 20-25%. But that comes with a lot of education and being like, this is on you. You put in all this work with us, and now it's on you to continue all the deadlifts, the squats, stuff that we've taught them along the way. And a lot of that just, go ahead.
Yeah, and it's also, exactly that strength maintenance is very important, but it's also just the simple neuromuscular training. Like, if you're a soccer player, the FIFA 11 Plus has got a wonderful injury prevention program. Yes, it's aimed at primarily preventing those first ones from occurring, but that program is fantastic for the person that's already had a reconstruction. They should be doing that one all year round, before every training session, before every game, regardless if they've got weight sessions or regardless of whether or not they can go to the gym. You don't need any extra weight to conduct that 11 plus program 2 to 3 times a week to reduce your chances of a second ACL injury from occurring to either side. And then a lot of other sports have got their own little programs, like with basketball. I think the old PEP or the Santa Monica program, that was designed for basketball players and court-based athletes, volleyball, basketball, indoor sports. That's what that program was designed for. And obviously outdoor sports being 11 plus. Now, there are plenty of other exercises you can do to maintain your current level of function after your ACL reconstruction and after you return back to sport. We just got to make sure your athletes are buying into these programs so that they do reduce their chances of that second ACL injury from occurring. So, it doesn't take much in theory, but that's trying to get that buy-in is really, really important.
Yeah, 100% agreed. And I think neuromuscular training or control is a really missed aspect of recovery, in my opinion, or even continued maintenance that we talked about. And it's just kind of, for me, sometimes I kind of have fun with it, where I have like a really high level athlete come in simple exercise, bound, jumping from one foot to the other. and you see they can't even stick a simple landing like that, and they're playing basketball, lacrosse, football, whatever it is, and you're playing that at a really high level, moving super fast, and you can't stick a simple, like a 6 foot jump a little bit,
Yeah.
it's you should be able to do that. And I
Yeah.
do the same thing. I encourage them, like, you put in so much work, and I pretty much incorporate some form of neuromuscular training into every single rehab session, because that's how much I
Yeah.
believe in it works. And
Yeah.
especially with the ACLs, it's kind of fun in the sense where they can feel the difference. Like, oh, for
Yeah.
if you do 6 hops on one side and 6 hops on the other, you have 4 toe taps on the
Yeah.
ACL side and only 1 toe tap on the other. That's a
Yeah.
easy, difference that they can feel and they can see. And
Yeah.
as they
Yeah.
practice, you practice, and you get better and better and better. And that's what it takes to continue, like you said, maintaining all the work that you put into the rehab portion of it.
Yeah, exactly. That, and especially that neuromuscular training, like jumping landing practice, hopping landing practice. You don't have to do large volumes of it to continue to see those really great changes and those great benefits. And because the ACL injury, it can become a brain injury. Like the neuromuscular impairments that we sustain and those strength impairments, like the central nervous system needs to be constantly fired up, especially after you've had a reconstruction, because of just those pathways and those proprioceptive inputs to the ACL. They're all impaired, and they can take up to 2 years to restore back to normal, but we can facilitate that and we can encourage it. But hopping, landing stuff, you could do that every day, in small doses, just to keep that brain ticking over and keep those movement patterns sharp and landing. You could do, 2 lots of 10 single leg hop forward and stick the landing, 2 lots of 10 off a 30 centimeter box, off to the side, up to the front, up and down and stick, or a hurdle stick where it's 1, 2, 3 stick, 1, 2, 3 stick in a forward plane or a side plane. Like that's not high dose plyometrics that you need 3 days recovery from. You could simply keep topping up that to make sure you're so strong, so stable, so confident, simply at home, just doing some simple stuff like that, or with your trainer or with your physical therapist. Like that's an important part that we need to maintain and really drive home from an early stage.
Yeah, and there's a lot of research like you just said, about the neuroplastic changes, and how much the brain is seriously affected, and how much we rely on vision when you're doing, like you said, the plyometric exercises. And I've seen you do it where you're doing a lot of multitasking, which is obviously how sports work. And I explained it to him, like, why are you making me look up, and why are you making me call a number out, or staring or turning my head to look at the clock, or making me do math? And I was like, when you play sports, are you only doing one single task at one time? And the answer is no. You're also thinking at the same time about, like, oh, where am I going to go with the ball? Where's my defender going? Where are all my teammates? There's so much stuff that goes on. It's not just one single task, and that's why rehab needs to match it. And obviously, there's a time and place for everything. You don't start with that, 2 weeks post-op. You do a
Yeah,
lot
that's
of
right.
the stuff later on, and it's really important to work in a lot of that stuff and a lot of repetitions, because that's what it takes to get better. It's a skill. Landing is a
Yeah,
skill. Learning how to control your body is a skill, especially after ACL rehab. So I really
yeah,
like the fact that you are encouraging people to maintain. It's not just strength; it's also the neuromuscular control aspect of it too. I think those are two
yeah,
huge points that, in my opinion, if people were even just willing to buy into that aspect of, like, the maintenance of strength training and neuromuscular training, we would see these these second tear rates decrease drastically just by those two simple things.
for sure. And I think to extend on what you just said there too, the multitasking and all that kind of stuff, that's, yes, there's a time and place for it too, but there's also too, you see some people extend that far too long and don't get that all important training exposure as well. Nothing will prepare you for sport like training, like the chaos of being involved in a training simulation where you're doing training drills, where you got balls flying at you, where you do actually have to make sport specific decision makings. Like that's a really important part of the process where I think often gets missed, or doesn't get missed, but just doesn't get done very well for long enough. Like that repeated training exposure, I feel, especially in unrestricted fashion, where you've gone through your ACL rehab, you've cleared your return to sport tests. Like that doesn't mean you're playing sport the next week. And we may be sort of already starting into that next question that we're already starting on. But like, I think the whole definition about return to sport, I think, really means it's really clear. In my mind, return to sport is return to training, return to unrestricted training where you're actually playing and involved in small-sided games, or you're involved in training practices where you're not having to pull out, of a drill for argument's sake. It's you're all guns blazing. You're training, and the more training exposure you can get, where that's ultimately the best thing for you. And right now, being restricted with COVID, obviously we can't get some, training sessions in with your whole teamwork, but trying to get some degree of match simulation was only better prepare athletes for when training sessions do resume again, so they can get right into the midst of full training sessions again, so they are ready to play and prepared for the demands of sport. So yeah, I think that's often overlooked, especially here in Australia. I think a lot of people get cleared to return to sport, and they're often under the assumption that they're ready to play their competition the very next week, and that's something that I think needs to change.
Yeah, I definitely agree with you. I think there needs to be an ease in process, something percentage based or minute restriction based, something along those lines, and a gradual increase in that. Just honestly, it's the same thing as your protocol. It's a gradual increase, a step by step increase. Same thing when it comes to return to sport. And something for me personally that I've been working with, I use a lot of like tennis balls and things like that to work on reactive movements. And yes, I agree with you that to a certain extent, you need to incorporate a live body. And that's when I usually insert myself, or they're reacting to me and I'm hitting them a
Yeah,
little bit, getting them used to contact. Cause it's scary for people,
yeah, exactly. Yeah,
or I've also done like paired joint sessions with two athletes who are in similar phases of recovery. And then they're just competing against each other. Cause I need to, like you
awesome.
said, I need to reproduce that same environment and that same stimulus as if we are competing in a game. Again, it's not the exact same, but I'm stepping towards that. And I think that's the whole process behind it.
Yeah,
Um, and,
exactly.
and something I also wanted to ask you is a lot of people, I asked on social media what people want to know. I know you talk pretty frequently on your social media about non-operative ACL tears.
Yeah, yeah,
And do you mind talking, what are your thoughts on non-operative? And also, I know some people might not be super familiar with the term COPR versus non-COPR. And can you share your
yeah.
thoughts about that?
Yeah, look, I think non-operative, it's a really emerging topic of ACL management, and it's often, you hear people talk, both patients and clinicians, and it's kind of like the the option doesn't really come in as a treatment choice if you're young and active, when it possibly could, and usually, in the past, you hear about someone going down a non-operative pathway. um, they're usually older, like they're a 40-plus-year-old male or female. But we're starting to understand that even younger athletes, even those that are involved in cutting, pivoting sports, actually can achieve a good outcome without a reconstruction. I guess the problem being is that it's kind of like a toss of the coin, who will be successful, who will have a good outcome, and who will actually need to have a reconstruction at a later date. So it literally is, 50% of the cases can go back to pre-injury levels of sport, or go back to high levels of function and cope really well without an ACL reconstruction. And the other 50% will actually go through some early rehab and go, look, this isn't for me. I need to have a reconstruction to get my confidence back. So we just don't know very well yet who those 50% are who are more likely to do well, and those 50% who probably should be, encouraged into a reconstruction at some point a little bit earlier in the case. So um, to then extend on that with the whole potential coper versus non-coper, a potential coper is someone that we try to identify pretty soon after their ACL injury. They also can be identified as a potential non-coper as well, because it's potential in that it's yet to be seen whether or not they would be a coper, or would they be a non-coper. So a potential coper is someone we try to assess early, and hopefully within the first 4 to 6 weeks, and we put them through 2 questionnaires and a 6-meter time top test. Now, if they pass those 2 questionnaires and the time top test, and if they've had no instability since their ACL injury, they're actually classified as a potential coper, and are encouraged to do at least 5 weeks of strengthening and neuromuscular training, as per this wonderful protocol developed by the Delaware Oslo group. So Lynn Snyder-Mackler and her crew of researchers back in the early 2000s and mid 2000s and 2010 developed some really good strength training programs to help ACL injured athletes. So twice a week for 5 weeks is what we encourage people to do after their ACL injury once their knee is settled. Now, people can opt to continue that rehab plan indefinitely, or after they've completed that program, then have their reconstruction. So that's kind of like the nuts and bolts of it. And I don't think enough of that is done. Um, I think a lot of people, unfortunately, will have an ACL injury. They'll consult with an orthopedic surgeon, and soon after, they'll have their operation. And that neuromuscular training, that 5-week program, will be beneficial in many ways. It actually is. Studies have shown that it can actually enhance your chances of returning back to sport after your reconstruction. So it essentially is a really good pre-op program for those that have already got in their heads that they're going to have an operation to stabilize their knee and reconstruct their knee. The good thing is those that are identified as potential non-copers initially, after doing 5 weeks of that program, they actually can change their coping status. And they actually can, up to 45 to 50% of them can turn things around and actually become a potential coper where their knee function's really good and they're strong and they're confident again. And then they, once again, can either elect to have a reconstruction after that or continue that rehab plan indefinitely until they choose, like, when the time's right for them, or they just keep going the rest of their life with an ACL deficient knee. So what I'd also would love to see more of is, in those that are still sitting on the fence, if they've done their rehab for 5 weeks and they're still not sure, maybe go out to 3 months, like give this knee a really strong fighting chance to see if they can cope without their ACL, or if they get to a point and go, hey, look, no, this isn't for me. Now, I understand things are very different between Australia and America. I think if you had a young athlete, a 16, 17-year-old athlete who potentially has a college, maybe scholarship up for grabs, and they're going to be an athlete at college and maybe have professional sport in their eyes, and to try and manage non-operatively with an ACL deficient knee, it's a hard task that we don't have great confidence in knowing, will this person have an instability episode in 6 months, 6 weeks, 6 days, 2 years, 3 years? We just don't know very well. So for those people that want a bit more assurity about their knee, I guess, being stable, it's not to say that graft won't fail either, but a lot of people like to have that sense and that control over their own destiny. And having a reconstruction can often make things a little bit clearer in their timelines of returning back to sport, whereas a non-operative plan can sometimes make it a bit grey, because that person may have a great outcome. They could go the next 5 years, 10 years without an instability episode. They could go back to sport, in fact. But they also could have an instability episode 6 months down the track and go, wow, that just didn't work for me, and now that I'm going to have a reconstruction. So I think ultimately ACL injuries do have a treatment choice, and it isn't always a reconstruction. A non-operative rehab plan is absolutely a viable choice. It just needs to be a very strong consideration, and there needs to be some team decision-making about what is best for that athlete and that person moving forward after that. And I hope I've answered that question. I took a couple of tangents there, but hopefully that's answered that question.
Yeah, I mean, that's a very thorough answer. And I think it's when you said that the non-operative route is gray, I was in my head, I was like, even the surgical route is sometimes gray as well.
Yes, yeah, exactly. It is.
So at the end of the day, both of us have, in our careers at this point, unfortunately, have had second tears to some of our athletes before. It's just, it's inevitable. No one's going to bat. If you're seeing a good volume of ACLs treatment wise, nobody's batting 100%. It's not possible.
That's right.
Sports and the nature of anatomy and all that kind of stuff. There's so many factors that come into play. We just do the best we possibly can with what's presented in front of us. And I think, I don't know about for you, but I have only maybe worked with a couple of non-operative people. Most of my athletes are operative, and that's exactly why, like you said, because probably it's what they've been told. It's also because it's a little bit more, I guess, structured in a sense, where it's like surgery, rehab, and then keep going. And then hopefully in 9 to 12 months, you should be back to playing sport, as opposed to, like you said, the gray area of non-operative. It's like, hopefully you won't have a buckling episode. You know, it's a tough sell, I would say,
Yeah.
but the potential, like, there's always a risk factor when you're introducing surgery to it. So that's also the negatives of surgery, obviously.
Yeah, that's right. And so I think that's the thing. You know, I think talking to people who have had an ACL reconstruction or have had an ACL injury, they've already got this mindset that one, the reconstruction will preserve them from arthritis, which it won't. It will guarantee them a return to sport, which it won't. So they're often the myths that we dispel early, and then they start thinking that, oh, if it's not going to preserve me from arthritis and it's not going to guarantee me a return to sport, you know, what's my other choice then? And then then you start talking about non-operative choices as well, and unfortunately we can't give great clarity there either. So I think the person just needs to make an informed decision based on what they want to achieve in the future. I think the risk is, and this is a big risk, when you pursue a non-operative plan, that if you're going back to pivoting sports, changing of direction sports, there is a chance that you may have another instability episode. And that next instability episode might tear the meniscus and make it irreparable. You might also have a cartilage injury as well, which once again may become irreparable. Now, a meniscus injury, meniscus injury and a bad cartilage injury can be devastating to the knee for the long term. And that's a problem. But that's also not to say a reconstruction will preserve you from those injuries either, because we know that follow-up meniscus debridements are often quite common after a reconstruction as well. So it's really tough, but we need to share this information, and that person then needs to make that informed decision. I had a non-operative, I've probably got at least 10 to 15 cases of non-operative management, and they're not all old either. You know, like most of my cases are in their mid-20s, early 30s. I've got a few people who are in their 40s and 50s who are, you know, skiers, for example, and have had ACL injuries. They're just looking to go non-operative. But I had a case recently where we were managing this guy non-operatively. He was 3 months post-injury and rehabbing really well. He was just completing a very simple jumping and landing drill, had an instability episode, had a bucket handle tear of his meniscus. And last week he had that meniscus tear repaired. So there are cases where it can not result in a great result. You know, it's not all sunshine and rainbows when we not manage non-operatively. So people do need to have this understanding that if you're going non-operatively, there's also a risk if you're looking to return back to sport. But surgery doesn't also make you immune from these risks either.
It's the fun side of ACL rehab that you and I get to deal with on the regular, where
Yeah,
regardless of which decision you make, it's going to be a little gray area. It's just at the
yeah,
end of the day, we are trying to present to them the best possible outcomes by giving them the best possible rehab that we can provide, them putting in the work and letting the body do what it's capable of doing. And that's the best that we can really do.
yeah,
And it kind of leads me to my next question, which honestly is one of my favorites, probably my most favorite, regarding people, especially for physios and PTs like yourself who treat a lot of ACLs. Why do you think re-tear rates are so high, and what do you believe needs to improve in order to decrease these re-tear rates? And just to clarify for most people that listen, when I say re-tears, I'm talking about a second tear, so that could either be on the same side or the other side.
yeah, yeah.
Regardless, we're bundling those together.
Yeah, look, I think the re-tear rates and second ACL injuries are very high, particularly in under 20s and under 25s, but mostly under 20-year-old athletes, and that number can be as high as 25 to 30% in the first 1 to 2 years post return to sport. Look, I think my gut tells me that, and the research will sort of be justified here, especially with a paper that came out here in Australia only 2 years ago, that with the current ACL rehab guidelines that are published, that have been published, and the recommendations that we meet as clinicians to put people through rehab, a group of ACL reconstructed athletes here in Australia, only 5% of them met those guidelines. So that's a very low number that are completing adequate rehab for an adequate amount of time and going back to sport in the right way. So look, adequate rehab, like strong rehab that goes for at least 9 months, that consists of jumping, landing, plyometric drills, that would be a cornerstone to what would be high quality rehab that the person must cover over the first 9 months of their rehab, if not 12. Now, some of that probably needs to be supervised by a physical therapist or an exercise professional to make sure they're doing things properly, and prescribed and progressively overloaded with time. That would be an all-important step, which a lot of people unfortunately probably don't get and don't do long enough. The other thing would be also to making sure that their rehab and their return to sport doesn't, begin before 9 months. We know that those athletes that return before 9 months have a greater chance of re-tearing simply based on time and the biological healing times involved. Yes, the ACL graft hasn't fully matured by 9 months, but the research will say that by 9 months, it can withstand the demands of sport in most athletes. It's still got some work to do. I think the big one is probably an absence of return to sport testing. I think that, hop test, strength test, particularly isokinetic quads assessment, and a series of hop tests, whichever hop test the person and the clinician likes to decide on. But I like a single leg hop and a triple leg hop for distance. That would be my two key ones. Of course, a triple crossover and a side hop test are quite nice as well. But also psychological readiness. The ACL RSI and the TSK11, those two questionnaires will give a great insight as to how confident this person is. And latest research will say that that's probably not looked at enough. And the scores on those tests actually can indicate a level of risk that a person has when they go back to sport too. So I think to answer that question, why I think there are so many re-tears is that people do crappy rehab, they don't do it for long enough, they don't get tested, they don't get supervised, and they don't have their psychological readiness assessed before they play. They go see their orthopedic surgeon at 9 months or 12 months, they have a Lockman's test or a pivot shift, and you get a big handshake from the surgeon saying, "You're good to go, son, off you go." Or here's also a brace that will get you to wear too. These things, I think that's why you have such high re-tear rates that we see getting around. So if we can change those, because the things that are modifiable, strength training, plyometrics, psychological readiness, training exposure, all these things are modifiable by the clinician working with the patient. And I think we can have much, much better outcomes if we just look after those simple things.
Yeah. And, I appreciate the kind of the quick and dirty recap of everything, because I literally agree with every single point that you just hit. And some of all of you can't see me right now, but I was laughing because it's what you just said right there is literally the exact same as even in the States, and
Yep.
everything's exactly the same. And that's why, these time criteria are honestly stupid, because it tells you that at 6 months or at maybe even 9 months, some surgeons are pushing it back now, thankfully. But even then, even at 9 months, there is no guarantee that you're going to be cleared. I think a lot of people are like, oh yeah, I'm 9 months, I'm going to be cleared. I'm going to be cleared. But I always ask them, like, based on what? Are you being strength tested? Are they even hop testing you at a bare minimum? Are they doing some form of testing? And if you're not doing any testing, you're basically guessing that athlete is ready to go back to a high level sport, which is absolutely ridiculous. And I'm in full agreement with you that there is a good amount of crappy care out there. And even just a quick little case is that I got an eval a month and a half ago. She was 5 months from surgery. And I asked her, questions I like to ask when I get a new patient are, what is the hardest quad exercise, or walk me through your most recent PT, session, just so I can get a feel for it. And she said the hardest quad exercise that she did at 5 months post-op was a TRX squat, which is not even bodyweight squat, that's even worse. So that, like you said, that is the definition of crappy care. Like, you should be picking up weights at that point. You should be moving a little bit, you should be doing a posterior chain strengthening, and none of that was being done. So time frame wise, in her head, she is 5 months. On a piece of paper, she is 5 months, and according to her surgeon, she is 5 months. And then let's say he clears at 9 months, but she only had 4 months of good strength training. That's not enough.
Not enough.
So we're trying to make up for that lost time that she didn't have with her previous physical therapist. And it's extremely challenging, because she came in to see me, and she's like, oh yeah, I've been jogging for 2 months at this time. And I was like, how can you be jogging when you can't even you can barely bodyweight squat,
Yep.
If there needs to be a structure, and in my opinion, a big piece is also an education portion of it, which is why I appreciate a lot about what you put out, because you're exciting people about like, oh yeah, there's a lot of different exercises that you can do, and it doesn't need to be complex, but I think some variability is important to make sure you're challenging the muscles properly. And also, like we talked about a lot during this episode, is neuromuscular training, utilizing different plyometric exercises. These are all
Yep.
extremely important things to add into rehab.
Yep.
And Mick, I definitely appreciate everything that you said. I know we're kind of winding down on time. I don't want to hold you too long. And do you mind just kind of giving us, a little bit your plugins as far as your social media goes and your website? And I'm going to make sure I plug in all of this into the show notes so that people can kind of go support you. And
Yeah, cool. No, thanks, Wes. It's been a great chat, mate. No, yeah, I'd love to talk for another hour. I think we could probably fill another hour's conversation, but I appreciate your time and asking me to give my input from down under. And it sounds like it's pretty consistent with what you guys are feeling in the States when it comes to this. So I appreciate that. Yeah, look, for anyone that's interested, yeah, I've got an Instagram page. It's mickhughes.physio. I've got plenty of exercises on my YouTube channel. Once again, mickhughes.physio. If you're on YouTube and you're searching on YouTube, very active on Twitter and Facebook. Just search for Mick Hughes. You'll find me there. So it's Mick Hughes, Hughes. But yeah, the Melbourne ACL Rehab Guide, it's a free website. Feel free to check it out. All clinicians listening or patients listening, you will have to connect with your patient and vice versa, so you can enter in the data just to make it valid and reliable. But that website is melbourneaclguide.com. And then our educational videos and ACL masterclass videos are found at learn.physio. So that's www.learn.physio. Yeah, plenty of stuff out there for anyone interested in ACL, looking to upskill their research and their learning in that space.
Yeah, awesome. And I really appreciate you coming on, Mick. And I all the stuff you put out there in regards to the research and the exercise, all that kind of stuff that really makes a big difference as far as the ACL rehab goes. I think you were the first person to really start putting out the research in regards to the physio PT world. About 9 months post-op is the bare minimum.
Yeah.
And I, as soon as you posted, I was like, yep, there it is. And I reposted it right away. I was like, people need to know, and people are kind of shocked at it. So
Yeah.
I appreciate you doing that. And I'm a big fan of yours, and I hope that you continue to put out really good content. And I definitely appreciate you coming on the show. And I hope you guys enjoyed today's episode.
Yeah. Thanks, Wes. I appreciate it. All the best to you, mate. You stay healthy, and to all your listeners, stay healthy and look after yourselves. And yeah, we'll talk again one day, Wes.
Appreciate you as well.
Thank you for watching today's video. Please feel free to like and subscribe and share it on your social media platforms. If you're interested, I have started an ACL Mastermind group, which is a growing library of content centered around ACL rehab. It has exercises ranging from immediate post-op to late-stage sport-specific movements and everything in between. It's a growing library and currently holds over 250 videos. There's content centered around assessments, movement breakdowns, exercise breakdowns, case studies, and a whole lot more. You also gain access to a private forum where you can engage with like-minded people, ask questions, share research articles, and share resources. If you're interested, please feel free to click the link below. Thank you for watching.